Welcome. I'm Jennifer Said, your host. Today, we will be talking about having difficult conversations with patients or clients who are hesitant about getting the COVID vaccine. Early into the conversation, a clear shift is made, and these conversations are no longer called difficult, but are referred to as honest. Our guests are Wanda Anderson and Jennifer Gunderman King. Wanda Anderson is a native of Maine and a disabled Army veteran. Since graduating with her Master of Social Work degree in 1990 from the University of Hawaii, she has worked as an administrator, advocate, clinician, and educator. Currently, she serves as a faculty member at the University of New England's Master of Social Work program. Over the past 10 years, she has presented extensively on social work ethics. Jennifer Gunderman King spent most of her life in Maine. She is currently pursuing a Doctor of Public Health degree from the University of South Florida. Jen is the Maine Area Health Education Center Director and a faculty member at the University of New England as well. She leads interprofessional, community-based education and practice focused on rural and underserved populations. Welcome, Jen and Wanda, to this episode. I'm so happy to be able to speak with you today about this important topic. And now let's hear from Jen as she helps us with having a baseline of understanding around vaccine hesitancy terms.
Sure. Great. Thanks, Jennifer. This is probably a great place to start, is just understanding what vaccine hesitancy is. And there's been a lot of conversations around what is the correct terminology. Some people like to use the term vaccine confidence. However, the World Health Organization has put together a document that outlines what vaccine hesitancy is, and that is the term to use. So vaccine hesitancy is the delay in the acceptance or the refusal of vaccination despite availability of vaccination services. So I think what's important to point out here is that it's not just an outward refusal, but vaccine hesitancy also includes the delay in acceptance. And that leads us to describe vaccine hesitancy as on a spectrum. So on one end of the spectrum, you have full and active acceptance, which we actually call demand. It's the first person in line at the COVID-19 vaccine clinic, the person who rolls up their sleeve and says, I'm ready. And on the complete other end of the spectrum are sort of the people who are just refuse all vaccines. And vaccine hesitancy is that spectrum between those two things. It might be someone who has access, meaning they may just have some questions that they want to have answered and some concerns addressed. You know, it could be vaccine hesitancy in terms of a person will accept some vaccines, but not others. Or maybe they want to delay some and not get so many at one time. And then it might just be outwardly refusing some, but being okay with others. The World Health Organization does a great job of outlining the three pillars to vaccine hesitancy, and they are confidence, convenience, and complacency. Confidence is how much do people trust the vaccine, but also how much do they trust the delivery system of the vaccine, the governmental entities, the healthcare system, and others involved in actually delivering the vaccine. Another component to hesitancy can be convenience. Does a person have easy access to vaccine? Do they have a way to pay for it? Do they have transportation to access? All those logistical components to being able to access vaccine. And then the last pillar being complacency. So complacency is where we use the health belief model sort of components where people are weighing the risks, their perceived risks. That's what the important is, their perceived risk of getting any adverse events from the vaccine, which we know is very small, versus their risk of getting severe disease from COVID-19. It's also them weighing what are their perceived benefits of getting vaccine over getting disease. And so that's how we talk about complacency in relation to vaccine hesitancy.
I wanted to set the tone that there is a difference between those who want the vaccine and are having accessibility issues,
yes,
from those who we are trying to engage in a conversation to maybe move them along the continuum.
Right. So those are the people where the two other pillars are really what's grounding their hesitancy, the confidence in the system, or questioning the confidence in the system and in the vaccine, and then the sort of questioning their perceived risks and benefits from getting vaccine versus getting sick, right, or maybe not even believing that COVID is an actual pathogen.
With us focusing on these things, we're really talking about how do we engage in a conversation, I guess, is rooted in trust. And Wanda, can you set the tone for what does that look like to even begin or spark a conversation?
Yes, thank you, Jennifer. And thank you for having me here today as well. I joined Jen in saying that this is a very fascinating topic. It's interesting in that I feel like as we engage in these conversations with adults, family members, clients, patients, that we really are approaching this at some point of having a client come in who is hesitant, if you will, and how are we going to bring them around to get the vaccination? And one of the things that I really encourage us to think about as we have this discussion is, how do we develop a trusting relationship, and how do we listen to their side and share our side? So we really need to think more about this being a shared conversation rather than a difficult topic or even a difficult discussion. Because when we approach that discussion around being difficult, I think we set up that tone immediately. And I think there are various reasons, as Jen started to talk about, why there is the vaccination hesitancy. And I think as caregivers, we really need to engage and listen to their side as well. So it's not about my talking about the reasons you should get a vaccination, but my understanding what is your hesitancy around that, and not even then trying to break down those barriers, but listening to what they're sharing and being empathetic with what they're talking about is how I think we begin that conversation.
Yeah, well, I guess, putting on my public health cap, when I hear Wanda speak, it just reminds me how aligned sort of social work and public health can be, because I think about what Wanda just talked about in terms of the interpersonal connections. And, I think about the socio-ecological model in public health, and that interpersonal, the social networks that we're a part of, are that next layer after our individual knowledge, attitudes, and behaviors. And, between us and, sort of that organization and community around us, I guess the other thing that I think about is, the stages of change. How do we get somebody to change their behavior? And it doesn't go from giving someone accurate information to expecting them to change a behavior, but that we've got to move from these contemplative preparation stages before we can really expect anyone to act. And those conversations around empathy being part of that pre-contemplation and contemplation stages.
Mm-hmm. Yes, and I want to jump back in there a second, if I can, Jennifer, in that I absolutely agree. And I think it's that notion that we need to begin in shared space. The intention is to have a conversation with the patient, not a preconceived goal that I need to get them to have the shot, but to engage in that honest conversation.
And besides meeting them where they are, what does that look like in practice? How does that conversation flow? And are there techniques that come to mind when you think about engaging someone in this way? Not, I'm going to get, my goal is to get you to get the shot, right? But more so, I want to meet you where you are, assess your pros and cons, something that Jen mentioned early on. So what does that? Are there tips? Are there techniques that we should be looking to guide that?
Yes. And again, I think it's very important when we begin to have these conversations that we really do step back and think about, not only what are the techniques, but what is our goal? And again, I think whether we're healthcare or we're social workers, we often in our mind, in the back of our mind, our goal might be to get as many people vaccinated as we can. And I asked if we step back from that. When Jennifer first approached and asked me to be a part of this, we were talking about, how to have some of these difficult conversations. And one of the things that I throw out is sometimes I like to label it as honest, not difficult. And I think by beginning at that point, one of the techniques really is remembering as healthcare or as social workers that our goal in general in our practice is to meet a client or a patient where they are and give them factual information. I do think in this case, we need to be very careful about statistics and a lot of data. It has been my understanding, and I think both of you would probably agree with me, that this pandemic has been incredibly challenging and passionate for people. So if I try to throw out a lot of data to you or a lot of numbers or a lot of facts from statistics or studies, I think my patient will throw back at me their own passion about what is true and what is not. So the information that individuals are getting is not always factual, but they believe it is. So I think it's important that we bring this down to a level of connecting with the individual. When I first started having this conversation, I'd said to someone the other day, I was going to join this podcast, and they immediately said to me, can you tell me how to convince some of my family members to get this shot? And I stepped back from that again and said, I don't really think the idea is, again, to convince individuals. I think it really is about having this shared conversation. We can use techniques such as motivational interviewing, which again is beginning at a shared space. Motivational interviewing is always about listening to where the client or the patient is at and showing empathy back and trying to understand it. It is never about challenging their views. It is never about trying to change their views. And it is never really about trying to get them to the point of your views. So I think that's the important piece. So we really want to start with that technique that when we see a client or patient who comes in general, let's take the vaccination out of it. When they come in to see us, we say, what's going on for you and how can we help you? And I think we need to begin to do that around this pandemic as well, to step back from that ultimate goal.
Thank you so much for sharing that, Wanda. And I think part of everything that you just said really aligns so nicely with how we opened up this discussion around trust building and eliminating that right from wrong dynamic, but truly engaging in a conversation, honoring where that person is and going through that journey with them as opposed to against them. So I think you really outlined that really well just now. Thank you.
Can I just add something else, Jennifer, and just maybe share a little bit of a personal story? Is I think just building upon that is also the concept of reflecting on a person's values. There's a lot of, I wouldn't say a lot, there's some research out there that absolutely confirms everything that we've just we're talking about, telling stories, not just using data, building trust, starting the conversations early. The time to start the conversation about vaccine isn't in the, at the clinic that the vaccine's being given at, or at the appointment that you're expecting to get, to give a vaccination. So to start the conversations early before there's actual the need to get the vaccine. And I think there's also something to be said about addressing where a person is coming from emotionally. If there's fear of the risk, if there's fear of that, 0.1% chance that they may have an adverse event from the vaccine, or if there's any emotional or physical pain that's attached to it, but then also kind of building upon potentially a patient's or population's value system. And I just give this quick example of my dad. My dad is 77 years old. He did not finish high school. He struggles with health literacy challenges. And he has been one in the sort of recent past where he is someone who is very susceptible and vulnerable to accepting misinformation. He had a political alignment for a while that questioned if a pandemic even existed. And I was struggling with the thought of even having the conversation with my father about getting vaccinated. And because I thought there was going to be a lot of hesitancy there based upon what I know about my dad, but he's also at incredibly high risk of severe illness, complications, and even death from COVID. So when I started the conversation with my dad, like, what are you thinking about the vaccine, and getting it? I was actually quite shocked. He said, of course I'm getting it. I'm like, whoa, okay. There goes, all my preparation for this talk out the window. And I kind of asked him, I said, why? He's like, well, I want this pandemic to be over so I can see my grandkids. And I know the vaccine is a way to do that. And it was the same rationale for why he wore a mask and why he, would force other people around him to wear a mask, even if they were quite apprehensive, because his decision was based upon his value of wanting to see his grandchildren.
Right. Thank you for sharing that. And as you were speaking, I was thinking about, because something that's come up in our previous conversation is, when do you challenge, their understanding of the facts? When do you tap into their value system? How do you know how to approach the conversation? It starts with just asking, what do you think about getting the vaccine, right? And then that gives us a sense of how to have the conversation. In your case, luckily, you didn't really have to do much, but it was interesting to hear for you to follow up with, well, why is that? Because that also allows for continuing the conversation along that way. But I think that's extremely important as we think about navigating these honest conversations as opposed to difficult conversations, is starting with, are you going to do this? And what do you think about that? Or even not putting it on them, because sometimes that people can feel attacked, if they think that you have a certain agenda, but just asking simply, what do you think about this vaccine? Or what do you think about COVID, to get a sense of where people are so we know how to tailor the conversation.
I just want to say to that, Jennifer, you are so right, because that's exactly correct. And listening to both of you, it has been, my experience that this is very personal, and it is those personal stories. And it is a notion that, just like you said, when you take the time to say, what do you think of getting the vaccination? How do you feel about this? That's where I think we make those initial connections and that trust building, versus every one of us, I think, in the back of our heads, you have that thought of what you just said. How do I challenge this? And I think if we can let go of that and think, how do I engage in a conversation? Because I think all three of us would probably agree that we've been surprised by different individuals. I've been surprised by some of my family members who were for or against for various reasons. So it really is not about data or knowledge. It is really personal for everybody.
Mm-hmm.
So Wanda, I have a question for you. If that's okay.
Yeah.
So, I've worked in vaccine preventable disease epidemiology. It was one of my first jobs here at the state of Maine. And when I took on the job, I had no idea. I was actually quite ignorant to the hesitancy around vaccine. This was back in 1998. And so what was actually kind of stirring the pot of hesitancy were stories. And it was the stories of parents who had children who had, say, autism, who, got misinformation based upon, that infamous Wakefield study, who would come to me, like after giving a panel presentation or a talk, would come to me and say, but my child has a vaccine, they have autism, and it's due to the vaccine that they got. So this is where it becomes really challenging in public health, because we know that stories can be really impactful outside of giving somebody a bunch of data, but then sometimes those stories work against us because they're based in sometimes misinformation.
You're absolutely right. And it's interesting because one of the things that I think we're challenged with for the last 15, 20 years is social media. And you're absolutely right. Those personal stories can either help or hinder, I think, the misinformation that's out there. And it is whatever somebody buys into. So I think if somebody has heard that story, and then maybe on the other side, they hear a positive story, they'll reflect and think about that. But I think you're absolutely right. The thing that I have come to learn, which is really surprising to me, I've heard a lot of people talk about how this pandemic is much more political. I don't know if I necessarily think that's true. I think it goes back to what you just said, Jen, that I have heard over the last 15, 20 years, this notion that somebody shares a story about something medical, about one individual, and it then kind of takes a life of its own and becomes, I've heard that about some of the newer vaccinations, and I think that's something that we really want to think about and not attempt to change somebody's mind, but maybe share a personal story on the other side of that. But it's very personal, it's very passionate, and it's very deep for people who have their beliefs.
Mm-hmm. And I mean, in light of all that social media and how quickly it spreads, right? And putting more trust in my neighbor that I've known for 20 years, and they told me this, sometimes even more than my clinician. I'm just thinking about the weight of that, of constantly having to, I'm trying to think of a good word, but trying to address that in a way that is still trust, rooted in building trust and all of that. I'm thinking about the fatigue on the other end, the fatigue that we may experience as health professionals, compassion fatigue and frustration. And so can one of you describe what that looks like and how it shows up, and perhaps ways that we can manage that?
I think probably both of us can. I'll start out, and I think Jen can add to this as well. I do think it's critical. One of the things that I think we are seeing in the helping professions is a significant increase in feeling fatigue, frustration, and even burnout. I have seen more colleagues step away from the field, retire early during this. I think this has really taken a toll. And I think a part of it I've seen with some of my colleagues is we do often get caught up in this notion, whether we're healthcare or social workers, that we really want to change the world. And our goal is often to try to impact every person we interact with. I often encourage colleagues to focus on if we impact one person, but when we get caught up and we want to really work with every individual and have every individual get a vaccination, and we're not able to do that, I think it really wears on us. And I've seen a lot of colleagues that I think put much stress on themselves around that really push themselves that they need to be successful in this with everybody. And, everybody gets vaccinated, we can get a handle on this. And I think it wears. I mean, I saw in June of last year, that our NASW, National Association of Social Workers, actually added self-care to our code of ethics to really push individuals to think about, how do you take care of yourself? How do you manage all of this? How do you take a break for yourself? The other piece that I think it's important to say in all of this is we all acknowledge, I think, that we're working in a different world today, but I don't know that we've all acknowledged that we are all different people today, that all of us are coming out on the other side of this pandemic as different individuals. And I think when we think about caring for ourselves, we also got to think about both the positive and negatives, and maybe how we've grown throughout this pandemic as well. But I'm not the same individual 2 years ago that went into this. So I think that's the other piece of it.
Mm-hmm.
Yeah, I think two things, Jennifer, from what you said is, first, I just because I find it like really, I guess I have a lot of curiosity around the role of social media and the spread of misinformation. And so I've done a little bit of digging in the research to really understand that. I think we're going to learn a lot more in public health about the impact of misinformation, because there's so many really cool data collection systems out there right now for looking at that. But I would just want to say is that one of the things that's been interesting to come out of that is to understand where the culprit is. And yes, Facebook, Snapchat, Instagram, those all have a role in the replication and the amplification of misinformation. But if we were to kind of like really dig into the impact of social media, it's the instant messaging apps that are really like they're the loudspeaker of amplification and replication of misinformation, because it's not just about a post. You are receiving a message from someone that you know directly, and then you're able to quickly send that out to your group of people. It's a little bit different than social media. So the first part I have to say about that is I think this is an amazing opportunity for public health to apply all the principles for investigating an outbreak to investigating the infodemic, which is an outbreak of misinformation. We need to use all those tools in the same way, including using really fun ways to collect data and analyze it and interpret it and use it for action. So that's kind of like one thing I just wanted to mention about the misinformation piece. In terms of the compassion fatigue piece, again, I go back to sort of public health, being in public health, not a clinician, first understanding what compassion fatigue is. So compassion fatigue is a little bit different than burnout. Compassion fatigue is the physical, emotional, psychological impact of helping others. And that impact can lead to like exhaustion, both physically and emotionally, that as a result, a person could become less empathetic and less compassionate about the people that they care for. So it's different than burnout or being stressed out. It's like to the next level where it's actually impacting the care that they should potentially be providing. And I think in that term, we, again, can have a public health approach. And one of the things that I have heard in talking with healthcare providers and healthcare systems is that it's great to be talking about self-care and resiliency, to be teaching and training people on mindfulness and meditation and yoga and exercise and eating well and sleeping well. However, one of the biggest barriers to actually addressing the issue are institutions addressing compassion fatigue and burnout and mental health issues in public health and healthcare professionals. So how do we shift our institutions to create a culture that addresses compassion fatigue and prevents it?
Absolutely. I just want to jump back in and say, in what Jen's sharing about compassion fatigue, it's critically important to think about that over the last 2 years, as healthcare providers, social workers, social service workers, hearing the stories or caring for patients and seeing the toll that this pandemic has taken on, not even just patients who have passed away, but family members and financial needs and the stress and the toll of jobs and all of this is exactly, you cannot really participate in this as a social service worker and not feel some compassion fatigue throughout this pandemic. So it is critical. And I do agree, we can try to take care of ourselves all we want, but if there's not enough nurses to care for people or healthcare professionals or social workers or family members, then you will get wore down. And I think the other piece I would like to say that I also think it's important that we remember that we are all trying to move on right now and pretend that we're back in a normal world, and we are not. There are still, I was talking to a local pediatrician the other day, and he said this area, from a very small area, is still diagnosing 4 to 6 cases a day in our area of COVID. And we are still encountering so many of these issues, and we are not back to a normal world. And as we try to do that, I think that is going to continue to add more stress to our social service and our healthcare workers as well.
Yeah, so as we move into going back to quote unquote normal, right? So how do you see this conversation changing around vaccine hesitancy? Do you see that emerging more? Well, what's the point of getting it since we're kind of back and COVID is over? Because it kind of feels like it is over because we're doing a lot of things that we used to do. Are there any thoughts on that?
So I would have to say, from a public health perspective, is that vaccine hesitancy was always there.
Yeah.
And like many things that the pandemic did, the pandemic really put a spotlight on how much it can stall and delay addressing an outbreak, a pandemic, an epidemic, whatever you want to call it.
Mm-hmm.
And we can take lessons learned around, how did misinformation play a role in that? Right. How did compassion fatigue play a role in that? Like we can look at some of the contributing factors and driving forces. So I think this is an opportunity to take those lessons learned in a meaningful way. For example, so I work with health profession students, and what I'm learning is that addressing vaccine hesitancy in patients and clients is not part of the curriculum, traditionally speaking, and part of health profession education curriculum. So there is an opportunity to start working with our health profession students to learn about how to have those conversations. And again, as Wanda had mentioned, starting with that whole trust building, you don't want to be talking to someone who's vaccine hesitant and immediately go, well, are you going to get the vaccine? Right? That trust started like the first time you met that client or patient. And so I think we have an opportunity to weave these conversations into health profession education and equip because vaccine hesitancy. So just as another little side story, my daughter is an emergency room nurse, and she just started becoming a nurse in the summer after she graduated from nursing school. I already see signs of compassion fatigue in her, and some of it stems from her frustration with having people in the emergency room needing to go right up to ICU and from COVID, and they were not vaccinated. Mm-hmm. She is struggling to have compassion fatigue under those circumstances. She is providing good quality care. She is having compassion, but I can see signs that this is starting to become a moral struggle for her. No part of her health profession education had these conversations. And so I think that we could do a good service to our health profession and public health students if we have these conversations during their education.
That's a great point, right? It's not new and it's not going anywhere. We need to think about it instead of reacting as things emerge the way we have with COVID-19. That makes all the sense to me.
I just want to add a couple of quick comments. And I think one being that, I encourage anybody who's listening to this, to remember, again, because when Jen just said this, compassion fatigue doesn't have to happen after 40 years of practice, and it can happen very quickly. And, it is important to remember that. So we do want to think about, when you're going to work, one of the things I often say to individuals is you should gauge. Most days you really should enjoy getting up and going to work. There will be a few days when you don't, but you really want to kind of think about that over time. And if you get to a point where day after day you're dreading it because of what's going on, then you may want to look at, because it does sound like maybe compassion fatigue is playing a role. And it is not something that means you have to quit your career. It means that we need to begin to step back and take care of ourselves. So that's important. And the other quick thing that I want to say is when you say, Jennifer, like, where do we go from here? I think it's really important that we think about, as healthcare professionals and as social workers, how do we continue these honest discussions, hopefully as this pandemic dies down, because it is not going away. And, we have a fair number of individuals who get their flu shots every year, and we have the hesitancy around flu shots as well. But how do we begin? Sometimes it's easier to have conversations when we're not in the middle of a crisis. So continuing to think about in our professions, just like I think Jen said, like, how do we build this in our curriculum? How do we have these conversations? And how do we continue to talk about vaccinations? So many individuals that we're talking with are individuals who've grown up with the idea of vaccinations. Like, I remember standing in school, like they lined us up and we rolled our sleeves and, you received your vaccinations and no one ever questioned it. So beginning to really think about how do we begin maybe a campaign of bringing it down to a more personal level and getting at this when we are at a healthier time and not just in the middle of a crisis.
Yeah. I think that concludes our conversation, and I want to thank both of you for being here and so insightful and providing us with a lot to think about. Thank you. It was an enlightening experience speaking with my guests today, exploring how a shift in how we see these conversations is a first step in addressing hesitancy. By replacing difficult with honest, we can realize a change in attitude. After all, attitude determines approach. Approach determines success or failure. We were provided with a baseline of understanding by describing key terms like vaccine hesitancy, the hesitancy continuum, compassion fatigue, and burnout. By asking the individuals we interact with, what do you think about COVID or this COVID vaccine? We set into motion a conversation that meets them where they are in a way that builds trust. We are encouraged to challenge the institutions we operate in a way that leads to a culture that addresses compassion fatigue. And for those working in academia, we are asked to think about ways we can thread vaccine hesitancy into the curriculum. I hope this conversation clarified ideas regarding hesitancy in a way that allows you to feel more equipped to have honest conversations about the COVID vaccine with anyone, regardless of where they may be on the vaccine hesitancy continuum. Further resources on this topic and detailed bios of our guests are provided in the description section of this episode. Thank you for listening.